I'm currently in Southern California, and I see folks are popping in from all over the world. I saw we had someone in St. Lucia. So really excited for this. And just a little bit about me. I'll be happy to answer some questions as we go through as well. But I started out as a pre-med. I always say I wanted to be a doctor since I was like 2. And my life took a journey and twists and turns, and seeing how I wanted to practice, I thought I was going to be a psychiatrist, and just life started showing me different things. And I realized that as I saw things being practiced, a different model made a lot of sense for me. I wanted to be a doctor that used nutrition. I recognized the power of the mind and the body. I had personal health experiences with family members and myself with integrative medicine. And so I stumbled on naturopathic medicine purely by accident. And I'm so glad I made the decision I've made. I currently, as they said, I'm executive director, so I'm fully in an administrative role. I interact with state, local, and governmental and provincial, even in Canada, regulatory authorities for integrative medicine, for academic medicine, and also as the chair of the academic collaborative, I interface with chiropractic, acupuncture, midwifery, massage, and other emerging world professions. So it's really been a fun ride, and I'm excited to talk to you today about naturopathic medicine. So the naturopathic medicine that I practice is based on 6 principles. And when I talk to students, this really excites them. The 6 principles of naturopathic medicine guide everything that we do, from our education to our patient care. And so first do no harm is part of the oath that all doctors take. And we look at this as really trying to find the most gentle approach for patients. And so whatever type of therapy that we're using, okay, is this going to harm somebody or is this going to bring them health? We recognize the healing power of nature. Identifying and treating the cause is really a key component. So when a naturopathic doctor is working with a patient, we want to see, it isn't so much about, okay, here's the symptom and here's the treatment for the symptom. It's why is this symptom showing up? So I always kind of think of, show of virtual hands. How many of you have had a headache? So, probably everybody could raise their hand. I could too. I got my second COVID vaccine on Friday, and I had a pretty wicked headache on Friday and Saturday. But there are so many different reasons for a headache. So it could be hormonal, it could be water, it could be a little bit too much alcohol, it could be stress, it could be muscle tension, it could be you just got a vaccine, it could be all sorts of things. It could be a tumor. And so naturopathic doctors go through why something is hurting a patient. Why is this showing up? And we work to address the root cause. We also work as physicians teachers. So again, virtual show of hands. How many of you know the root of what the meaning is for doctor? Doctor actually means to teach. If you go to the original Latin root term, which is docere, it means to teach. And so naturopathic doctors really focus on helping patients understand how to stay healthy. We look to the whole person, and we look to prevent illness whenever possible. So naturopathic, let's see here. There we go. So naturopathic medicine has a framework. And I always like to think of this slide as how a naturopathic doctor thinks about a patient case. And so at the base of the pyramid, you'll see that we're focused on the determinants of health. So this is stress, sleep, nutrition, exercise, social support, all of the basics that you need to be and stay healthy. And NDs start with our patient case of, okay, where does the person fit in on this pyramid? And then from there, we'll go up in force interventions. And then at the top, high force interventions and suppression of symptoms. That would be things like drugs and surgery. And so for a naturopathic doctor is really focusing on where does the patient fit in this pyramid? Do we need to work at the bottom? Is the root cause of what's going on there? Or, and I'm no longer practicing, but when I did practice, I had patients coming in all all scopes of different types of health conditions. And sometimes it was, you know what, I am not the right provider for this person at all. They need to go to the ER, or they need to go directly to a specialist, or, what have you. And so, we are trained to triage, we're trained to understand how to slot a patient, but usually NDs are going to be focusing at the bottom of that pyramid, like I said, on stress, sleep, nutrition, exercise, good thoughts, social support, all the basics for health. And so that is really the foundation for how an ND works with a patient. And I see the questions are coming in here, and I'm super excited to answer them as we get along a little bit later. So one of the things that is really common when we're looking at naturopathic students, oftentimes people may have not heard the word naturopathic. Like, I had no clue that this career path existed. And so often we're seeing from our students that they want to take a holistic approach. They want to spend more meaningful time with their patients, and really get down into the nitty gritty of why they're sick and help them heal from that level. Sometimes we see students who have different cultural backgrounds, where maybe they were raised with different types of traditions and traditional healing, or they recognize through either travel or family that there are other ways of addressing health and disease and dysfunction. So, as I said, our students are amazing, and they run the gamut. We have students fresh out of college who just completed undergrad, and we have career changers and everyone in between. And so, one of the really cool things that we see is there are often these threads. People are socially concerned. They're really inquisitive. They are academically successful, and I will tell you, naturopathic medicine is medical school. And so you have to be able to handle the rigor of the academic curriculum. But there's also this thread of community that is really wonderful about naturopathic medicine school. I just celebrated my 20th year reunion this summer via Zoom. So instead of a big old party, we had a Zoom party, but it was still nonetheless. And what I can say is my classmates were part of the reason that I got through naturopathic school, and vice versa. We leaned on each other so very much in just everything about school. It's rigorous, and there were days where it's 6 or 7 a.m. start, and you finish the day at 9 or 10 o'clock at night, and it's very long and grueling days, and your friends and laughter and social support really helps you through that sometimes. So I talked about that already. So what do we study in naturopathic medicine school? So the first 2-ish years, hello? I'm getting some feedback. Okay, so the first approximately 2 years are going to be all the biomedical sciences. So I call this all the ologies: anatomy, phys, biochem, human phys, pathology, pharmacology, etc. And then woven through all of that are the 6 principles that I talked about. So anatomy is anatomy. I always say, the bones don't move because you study them in naturopathic school. The biochemistry doesn't change because you study at naturopathic school. But what is unique to naturopathic medical education is that as you're learning anatomy, as you're learning biochem, you're learning the interconnectedness of things. So how the biochemistry of the liver might impact the hormonal system, or detoxification, or food sensitivities, and all of that, and how that all weaves into the patient sitting in front of you. And how does that show up in the patient? And so that's the really nice thing about naturopathic education, is that those philosophies, that addressing the whole person, is really core to everything we study. And then in the clinical education, we're getting cardiology, we're getting, again, all the ologies, but what you're also getting in naturopathic medicine school are the naturopathic modalities, the things that make you a naturopathic physician. So we learn conventional diagnosis and treatment. You know how to read labs, you know how to order labs and diagnostics and things of that sort. But then you're also getting substantial amount of nutrition education, acupuncture and traditional Chinese medicine, physical manipulation, mind-body medicine, botanical medicine, and more. And so all of that is in addition to understanding conventional physiology, diagnosis, and so on. And it's interesting, I'm married to an MD, and when we first started dating, almost 15 years ago, he was totally clueless about what I was doing. And, and I talked to him about nutrition and I said, so curious, how many hours of nutrition did you get in school? And he's like, oh, I think, between like parental nutrition and so on, maybe like 12. and so like, multiply that, add some zeros for how much we got. And so, I think when you're thinking about, what we're doing and where naturopathic medicine really makes an impact, it's in chronic disease. It is in all of the diseases that we see today that are impacted with lifestyle: heart disease, diabetes, rheumatoid arthritis, autoimmune diseases, allergies, digestive symptoms, women's medicine, all of those things. So that tends to be where naturopathic doctors really can make an impact. So our clinical experience can be woven through the curriculum. There's a minimum of 1,200 clock hours of clinic that happens all in different types of clinical settings. Although I will say naturopathic doctors are primarily in outpatient settings, not in hospital settings. And so the prerequisites: you need an undergraduate degree. The sciences are important to show that you can demonstrate, a good academic grasp of that. And, people will ask, what major should I have? And what I can say is we have folks that are in traditional pre-med majors like bio or chem or, kinesiology and so on. And then we'll have folks that were career changers or came from a totally different path when they decided to do this, and they go and they get the science prereqs, but, they have to, really make a good dent at that. And so in addition to the prerequisites, so there are required things like bio and chem, additional coursework. I always tell folks to just check with the schools that you're interested in to make sure that you're meeting their requirements. And especially now with COVID, some things have been loosened or changed just because, we are in a unique time that doesn't need to be expounded upon. And then, the GPA requirements are all on our website as well as with the schools. And so the one thing I will say, though, is the MCAT is not a requirement. And so for some folks, that may be something to, to just consider. It's a holistic review of the person, and it is not just a focus on one number being, the definitive factor of what is going to determine you becoming a doctor. So as I said earlier, the naturopathic therapeutics, like I said, nutrition, mind-body medicine, lifestyle counseling, hydrotherapy, which is the therapeutic use of water, botanical medicine, homeopathy, acupuncture, Ayurveda. There's so many world medicines. I know a lot of people are very sensitive about diversity now. And as a Latina myself, in school, I was interested in, what are the traditional healing modalities in the Caribbean of where my people came from in Africa. And so very interesting for me. And so the different areas of practice for NDs often follows how much we focus on the basics. So you'll see digestive disorders, so much centers around nutrition and the gut and gut health. And so that, when you're looking at this slide, there's really a lot of NDs that walk the talk and, focus on that as a major component of their practice. Women's health is also a big part. Insomnia, fatigue, a lot of people tired, a lot of people having trouble sleeping. Mind, body, mental health is also a big issue, and right now, especially so. I think the isolation, the change in work, the impact of the pandemic has taken a huge emotional toll on so many. Raising anxieties, people who were normally maybe a little bit anxious, now that has really just been exacerbated. So anyway, in naturopathic medicine, you have many career options. You can go into clinical routes, administrative, academic, entrepreneurial, and we have NDs in all these different paths. There are NDs working at the NIH, there are NDs working in the VA system, they're in academic medicine, and in just many different types of settings. And there is a huge amount of growth in the industry, as well as for careers in naturopathic medicine. So where do they work? Where do we work? Bulk majority are in a private practice, and these numbers don't add up to 100 because some people will have multiple places of employment. I will say one of the things that folks often are drawn to in naturopathic medicine is the flexibility, the ability to be able to create the dream career that you want. And, what does that look like for you? And oftentimes I see people saying, well, I love practice and I love patients, but not every day. And so, sometimes people will set up 2 or 3 days or 4 days a week, and they will do other things or kind of patchwork together. Some folks like to teach, or they want to write, they want to write a book, or they want to do some public speaking. Other people will have consultation practices where they're doing some consults on the side. The natural product industry is another area where a lot of NDs are finding really positive employment. And this data is all from the AANMC compensation study that we held last year. So an educational comparison. This is something that's also up on our website. And when you're talking about kind of geeking out with education things for a second, education is based on competency development. And so you have to demonstrate that a student has met and received and achieved competence in a specific area. And so, we just did a cross-section of the different competencies across other medical professions. And all of us, all these professions have to check off the marks. So diagnosis, treatment, patient management, communication, professionalism, all of these are competencies across all of these professions. And then the educational comparison, you'll see that, again, in these professions, years of undergraduate medical education, 4, and that's undergraduate medical education, which is differentiated from undergraduate. I know it gets kind of confusing, but medical school is actually called undergraduate medical education, and then residencies are called graduate medical education. So for folks that aren't familiar with the terminology, it can be sometimes a little bit confusing, but you'll see that the average credit load for ND school is actually substantially higher. Like I said, it's very rigorous. There's a lot of classes. And then in the clinical components, so yes, and I'll get to the schools. I know that there are a bunch of questions coming through, but I will get to the schools and locations in a little bit. So the biomedical sciences are covered across the board. Where you see differences is going to be practice patterns. And so like I indicated earlier, NDs are going to be predominantly in these outpatient settings, working with chronic disease and working with patients in that component and parameter. And also, as I mentioned, the amount of nutrition and things like integrative medicine and physical health are also much greater in naturopathic medical school. So the types of work environments, again, pretty similar across the board, with many more opportunities really growing for naturopathic medicine. And so lastly, I know that there was a question about the schools. So here's a slide on where the schools are located. And so in Canada, we have 2 schools, one on the East and West Coast, and then Bastyr. I think there was a question, is Bastyr one of our schools? Yes, they are. NUNM, Bastyr's campus in San Diego, SCNM, and then NUHS. And any of the schools will be happy to speak with you if you have additional questions about the profession. So one of the things that sometimes people ask, what should I major in? What are the majors? And so we see that there are, the close to majority are in the biological sciences, but then, there are folks that have majors across the board, as I indicated earlier. The age distribution tends to be in that a little bit after college range. So some folks slightly a bit older than just like right out of college. We do have a fair number of career changers, people who have gone in other paths and then say, wow, this is amazing. I want to do this. Or I've had a personal health experience and used natural medicine, and I need to do this with patients or as a career. So the application materials, we have a naturopathic doctor central application service where half of our schools are on. You'll need your transcripts, your letters of recommendation, in-person interviews. Right now are, we're definitely sensitive to the ability to travel at this point. And so many of the schools have moved to virtual interviews. But again, that's something just to confirm as things shift and change, hopefully back to better, that we'll be able to be seeing each other more in person. So I wanted to talk just a little bit about patient care, because there is a big difference in how a naturopathic doctor is going to address the patient interaction. And that's something that I often tell folks, like, if you have not seen an ND yourself, go see one. If you're really truly considering this, or ask them to shadow if they will take you. I know this time is a little bit different, but it's really something to, if you're truly interested in this, to share and to share in and understand. So the first office call or first visit is anywhere from 1 to 1.5 hours typically. And that is because you're getting into very, very deep relationship with that patient and understanding all of the nitty gritty and, asking questions. I remember my very first naturopathic visit as a patient myself. And I was like, what, why are they asking me all of this? And it was, energy, sexual energy, bowel movements, dietary habits, exercise habits, your work ergonomics, how are you sleeping? What's your stress level like? How do you relieve stress? All of that is very important and central to an office visit with an ND. And also because patients are partners in their health, it isn't just, here, take this, you'll get better. It's, let's work together to get you better. So you really need to engage the patient so that they are part of their healing process. It isn't just a, here, take this pill, or here's the treatment. It's, you're a partner in your health. And some of this is going to be dependent on what you're able and willing to do. And so follow-up visits can be also a bit longer than traditional conventional medicine practice. So the scope of practice is going to be a complete biopsychosocial history. As I mentioned, there may be physical examination labs as indicated for the case. We will come up with a differential diagnosis and referrals when indicated. And then when it comes to coming up with the therapeutic options, like I said, the patient is involved in the case, and and that is core to how we come up with the treatment, and then you follow up as needed. And so I always think of, there are a number of patients that I saw. When I was in clinical practice, I also supervised medical students in clinical training, but it was always really neat to see the person who had gone to every specialty, had gone to, and tried everything, and essentially failed on all of those treatments, and came to us as a last resort of, please help me, nothing else has helped. So there was a female I saw, she was in her mid-late 60s with chronic insomnia. And she had, essentially could not fall asleep. And so what happened was, she'd gone to psychology, psychiatry, acupuncture. She tried it all, and just had chronic sleep issues. And so she came to, I saw her and, went through the history and what have you tried, what's worked, what's not worked, and asked her one really simple question. When did this start? And it's a question that, like, everybody asks in medicine. It's not unique to naturopathic medicine. But, I led her through, she talked about childhood, and I led her through just a guided visualization. So like a guided imagery of, telling me and imagining and envisioning when this thing started for her. And she shared that her family had been involved in a cult, and they used to do, and I'm not going to get graphic here, but they used to do some bad things at night. And so unfortunately, she felt this like hypervigilance, just over alertness, that she had to stay alert at night to make sure no bad things happened. And that hyper awareness, hyper alertness stayed with her, and she was never able to let it go. And so I followed back up with her, and yeah, oh my God, it was awful. And she was the older sibling, and her sister was also involved in it as well. And so, without going into any details or anything like that, but it was really horrible. It was the type of thing that, in today's day and age, she would have been removed from the home. So, uh, not to say that long-lasting trauma can also have hormonal impacts on your cortisol system, on your sympathetic nervous system, on cortisol levels and all of that. And so, but ultimately I worked with her to create a sense of safety, and cognitively, to understand nobody's coming in the middle of the night to grab you, nothing is going to happen to you, you are safe. And she was able to move past the pain and fear of that initial trauma, because the insomnia wasn't like a sleeping medicine deficiency. There was a cause, there was a tangible issue that was the root of it. And that's just one example. There are so many different cases that I saw. I worked in HIV medicine back in the late 90s and early 2000s, when the antiretroviral therapy was really just starting to take hold and make some serious headway in life expectancy and quality of life. And my role with those patients was not as a primary prescriber of the antiretrovirals. They had doctors that did that, but really in a supportive role for things like neuropathies that they had in their feet as a result of the medication, or bowel issues, and making sure that they could tolerate the therapies. And then most of those patients had comorbidities. They might have had hepatitis, they might have had heart disease or diabetes or other things, or mental emotional things that we worked on as well. And so it was really a wonderful population to work with, one that I still think of really fondly. And so there are just so many different types of clinical opportunities. But the one thing that you'll hear from NDs is that working with the patients and seeing people get better when they really weren't given options is so gratifying. And so I'll leave that there. So as I said earlier, there are a lot of different types of career options available for NDs. And we do tend to see a very high level. Now, I will say there is no profession, I don't think you can find me any profession under the sun where 100% of everyone is satisfied with it. My husband's an MD. I hear doctors and nurses complaining about work all the time. I have friends that are teachers, friends that are dentists and lawyers, and you have it, and from the gamut, and you're never going to have 100% satisfaction rate. But we do have a very much higher satisfaction rate than just about any of the other health professions. And I think so much of that is tied to the fact that people are passionate about this. When you have seen healing happen on a one-on-one basis, there is so much validation in that. So as far as regulation goes, we have board examinations. So you take part 1 after your biomedical sciences, and you take part 2 after you graduate, and they are required for practice and regulated practice across the U.S. and Canada. So I know there were some questions about regulation, and let's see. And so the teal states here, or provinces, are all the regulated provinces. The ones in the darker are pending legislation, and the ones that are the light colored are in process. So what I will say is when I graduated ND school, when I started ND school, there were 3, and the number has grown, and 3 schools. And over the years, we have seen just a huge push for regulated practice as the profession is growing, as the numbers of NDs are growing across the US and Canada. There definitely has been a very large push for regulated practice. So I just wanted to give you all a heads up. We do have, from AANMC, we have free regular events. And every month we host free events. So on February 8th, in a couple weeks, we have Dr. Gonzalez talking about toxins in our environment, things that we can do to stay healthier with our air, our food, our water, our hygiene products, and so on. In March, we're going to talk about postpartum depression and naturopathic approaches to helping moms handle some of the hormonal ups and downs that can happen after the delivery of a child. We host a naturopathic virtual fair twice a year, and so our next one is March 18th. And we'll have representatives from all of the accredited schools there to speak with students, and they'll have students and alumni and faculty members and admissions folks. So if you have specific questions for a school, that's a really great time to go, because you can get them all kind of in one place. And then in April, we'll be talking about gut health and how do you balance that. And so we always have these free events. That's something that we do from every month, and we also archive them all. So if there's something that you're not seeing in the near future that maybe you're interested in, like pediatrics or cancer or heart disease or so on, there are lots and lots in the archives to check out as well. So on behalf of our member schools and myself, I thank you. If you have any other questions after today, I'm going to do my best to get to all the questions that have been asked. But if you have any additional ones, info@aanmc.org will get your questions answered. And so with that, I will turn it over to the moderators.
Thank you so much, Dr. Yanez. That was super informative, and we got a lot of really good information. There were a lot of questions, so we'll go back and go through some of them. And if you guys have any questions, please re-ask them, because they might have gotten lost up in the chat. So one of the main questions that a lot of people had was if you could kind of talk about if there is a stigma around naturopathic medicine. Do people see you as real doctors? Can you, and I mean, you're married to an MD, so kind of like how other doctors view NDs.
It's a really good question. So, I will say that the opportunities for naturopathic medicine have grown immensely in the past 2 decades since I've been involved with the profession. And I can share maybe a little bit about my own personal path as a female and also as a Latina. And in life, there are going to be naysayers. Like there's always going to be somebody out there that's either, not going to be supportive of your ideas or your whatever. And so, in the sense of a stigma, I have seen actually more support, especially as things like organic food are not weird anymore. It's not weird to say you're eating organic, or I'm trying out a gluten-free diet and to see if that makes a difference in my health. Like those things are not strange and I'm using air quotes, but strange anymore. They are very much more normalized. You can get organic food at Costco and Walgreens and Walmart. And, it's very much more part of the norm. And so what we have seen is oftentimes if there is any of that stigma, it comes from a misperception possibly. I remember years ago, I had worked I was doing some lobbying work and legislative work. And some of my very first meetings, people would know that there was a naturopathic physician coming to see them. And, folks would say, I was expecting you to look less professional. Well, what were you expecting me to be? Waving, flowers and, crystals around or something. I'm like, no, I'm here to talk about law. Let's talk about some policy. And they're like, oh, okay. So, I think oftentimes, just as people have, unfortunately, preconceptions about, races, genders, cultures, etc. How do you change that? You change that with education. You change that with relations. You change that with communication. So what I've found is oftentimes people's perception gets changed really quickly as soon as they meet a graduate. As soon as they talk to someone who has gone to an accredited school, a lot of that, the things that they might have kind of filled in the gaps in their head start to go away. And, oh, you have 4 years of medical school? I didn't know that. Or, oh, you take board exams? You have to pass background checks? It's like all of a sudden, like the connections start to get made. Oh, this is you're real. Like you are a real doctor. And so, I remember in naturopathic school, and I'm totally dating myself here, but I was just one of those go-getter kids, and I wanted to make sure that I had a really varied educational experience. And so I went through the phone book. Yes, I went through a phone book. I went through the phone book and I started calling doctors' offices. And I got one doctor who was, he was the team doctor for the Phoenix Suns. I did my training in Arizona, the Phoenix Suns and the Coyotes. And I said, would you mind having a student come and shadow and spend some time in your office? And so I did. And he was actually an osteopathic doctor and a surgeon. He was, fully a surgeon, like not, did not do osteopathic manipulative therapy. Like he was a surgeon. And so he said, sure, come on in. And, as we kind of started talking and such, folks, he offered me a job, and I said, I'm in my first year of school. I can't, thank you, but it's going to be a while. And, because he recognized when patients came in with joint pain, he basically had drugs and surgery to offer them. If you go to somebody who has a hammer, everything's going to look like a nail. So for him, it was, well, I can give them drugs and surgery, but sometimes they don't need that, or they could use other things first. And so, what I see in relation to that stigma piece is there's, once people really get to know what our what our wheelhouse is, it's exciting. It's like, oh, you get to do this and you can do that. And whoa, okay, cool. So I get a lot more of that than like, oh, you're a naturopath. I honestly really don't see a lot of that at this point in my career.
Great. Thank you so much for sharing that and sharing your personal experiences. I think a lot of people are good to know that it really just takes informing others to kind of get rid of that stigma. Another question that we had was, which states can NDs be licensed in? And depending on that answer, do you think more states will recognize the ND license in the coming years?
So this slide that I had up has the regulated states. So everything that's in the teal is regulated currently. And in that little tiny thing over here is Puerto Rico and the US Virgin Islands and Washington, DC too. But as far as new states coming on board, absolutely. So I can tell you I'm regularly involved in legislative efforts, writing letters, in communication with legislatures. Just recently, I've been in touch with folks in the state of Virginia. They're having They actually started having hearings last week for a bill in Virginia. So it's a constant thing, but it's for sure growing. And like I said earlier, the last 10 years or so, we have seen so many new states coming on board.
Great. Thank you so much for sharing that. I know a lot of people are interested in it, so I'm glad there's a push to continue, making those available.
I'm not stopping until we're at 50.
Great. There was a question, you did just mention osteopathic medicine. Could you touch a little bit more on the difference between NDs and OMMs? Because we know there's some OMMs, as you said, that go more into the surgery or medicine side, but some also like to go into the more holistic approach.
Yeah, you bet. So this slide here has conventional medicine and osteopathic medicine together, not because they're exactly the same, but their educational trajectories are more similar, more similar. And so from a training perspective, I always tell folks, if you're interested in osteopathic medicine, talk to ACOM. They'll have way more current information than I can. What I will say, though, is the strength of naturopathic medical education is that if you're interested in the integrative health sciences, you're getting that from day one. The philosophies are woven in your clinical training, in your didactic training. All of that is focused on the philosophies, the natural therapies. And so that's what you're studying to do. If you go to osteopathic school, you're also getting a lot of the conventional medicine and, like I said, surgeries and things of that sort, and hospital-based care and what have you. And so oftentimes, additional things will need to happen after graduation, after your residency, additional training after the fact. So much of our education is it's hardwired. Like, you're going to ND school, this is what you're doing. You're doing integrative medicine. And so I really just think of us as the specialist in integrative medicine. We are the top of the tier, and it's really the most efficient way to get your integrative medicine training too. It's 4 years. And at the end of that 4 years, you can walk out the door and practice, assuming you pass your boards.
Great, thank you for that. Just kind of going off of that. So to clarify, if, a physician wants to go through MD or DO school and then later decides they want to do, something a little bit more holistic, something about your lifestyle and specialize in lifestyle medicine, that just essentially gets to the same point, or would you say they're different, just like with more time and more money? Probably
a lot more time and a lot more money, but also, and again, I have like the inside scoop being married to an MD. It's two different ways, so you have a holistic way of looking at a problem and you have a reductionistic way of looking at a problem. And so you still get to an answer to that problem, but you're getting at it from two different ways. So we have MDs who have gone through a program, and DOs and dentists and nurse practitioners and so on, who, finish and they work and then they're like, oh, I want to do this instead. And so I don't want to say there's a level of unlearning, but there's a new paradigm. There's a new way of thinking when you're thinking about a case holistically versus like, okay, you have a headache. Let me ask all the questions about the headache. And okay, here's my treatment for your headache, versus you have a headache. Tell me about your stress. Tell me about this. Tell me about that. Tell me about your exercise. What about your bowel movements? Like, you're asking about my bowel movements and stress? Yes, we are, because there's a connection, or there could be. So it's a different way of looking at the patient case. So that often will take kind of a mental shift for people to make that shift. And when you're going, when those folks are going through the admissions process, the admissions folks need to make sure that they can take that shift, like that they can go and they can, make that shift to look at something holistically. So, there are programs that will take somebody who's got conventional training, and ND school also will take them, but they're going to be advanced standing. So it's going to be another, couple of years at least of school on top of the 7 at a minimum that they did conventionally. So it's a lot longer of a trajectory if that's ultimately where you want to go.
That's great. Thank you for clarifying that for us. Mm-hmm. There was a question, if you could clarify exactly, can MDs be in the same specialties as MDs and DOs? So can you specialize in like pediatrics, cardiology, like those kinds of things, or is it more just you work with all people?
So that slide that I had on, where was it? On different practices. So there are people who do focus, most NDs are going to focus on general family practice, but increasingly we're seeing people focusing on pediatrics, on oncology, in, cardiovascular medicine or geriatrics, or, pick an atric, pick one. We are seeing people focusing just because areas are so broad, and it also helps from a marketing perspective if you're more specific. So if you can target a specific population, especially now that so much is digital as far as marketing, it's a lot easier for people to market their practice if it's not just like this big all catch-all family practice, although there are a lot of people who do practice family medicine.
Okay, thank you. Great. Thank you for that clarification. I think some people were still kind of confused on that, so that's good to have. I think there's a question about practicing as an ND. Do you, are you allowed to practice in hospital clinic settings, or is it more of like private practice, you start your own or you join another private practice?
So as that one career slide show, the majority of folks are in an outpatient setting, typically a multi-practitioner setting. So there might be any combination of conventional folks, MD, DO, nurse practitioner, PA, nurses, and then there are usually going to be integrative practitioners as well. So there might be an acupuncturist on board, or a counselor, or a nutritionist, and it's typically this like integrative setting that that folks will be a part of. Just yesterday, I was on a call. Yes, I was on a work call on a Sunday. This is like COVID life, like work never ends. But I was on a call yesterday with one of the residency directors at the University of California, Irvine, and he's in a hospital setting. Now he's a little bit of a unicorn. There, most NDs, as I said, are in outpatient settings, but he's at UCI and has residents and is in their academic medical setting. And so he's in more of like a conventional setting, but they, have a very specific integrative center. And in addition to, all of the other specialists, they have naturopathic doctors on board.
That's awesome, actually. So thank you for sharing that. You did mention PAs and NPs, and a lot of people were wondering if they do work with NDs, specifically, or if you would just see that in the multi-practice, like they'll just be in the practice as
no, we're part of the healthcare team. So, there is, it really is going to depend on what's best for the patient. And, that's ultimately what it's about. So it's really what is this about? It's what the patient needs. And there are going to be times where the patient is going to require multiple practitioners working together. I've had a lot of friends of mine, colleagues, who've been at Cancer Treatment Centers of America, which is a hospital chain across the US. And they have a fully integrative team approach to cancer care. So they have the oncologist, the surgeon, the radiology, they've got everybody. They have spiritual counseling. They've got the naturopath and the nutritionist and acupuncture. Like everybody meets at the tumor board meeting and they all talk about the patient. And that's ultimately what it's about. So yes, long answer to your short question.
Thank you for that. There was a question a little bit more specifically for you. Do you think that your background with your MPH had impacted you or, guided you in any way with getting an ND?
So I got the ND first. So when did I graduate? I graduated in 2000 with my ND, and I practiced and I taught, and I was on the accreditation board. So I started working in the educational component of like doing site visits to schools and seeing if they were meeting the standards and so on. And then, like I said, I started working on policy. And, as a young woman, I didn't know what jobs were available. I just knew okay, you go to medical school and you become a doctor and you practice. It was really here. And so as I started working on policy, I like this stuff and I'm good at it. And I had no idea that that was even a thing, so I had no clue that you could go into health policy. That was just not ever on my radar. And so after a number of years, I worked in New York doing policy, and then I worked in DC doing policy. I was on the Hill in 2009 when the Affordable Care Act was being put forward as legislation, and working on getting integrative medicine into the Affordable Care Act. But then so I started my MPH in 2010. So after I did, my Hill work, I was like, I want to advance this part of my career. And I'd already been in the profession 10 years, but that was for me kind of the next logical step was to go get my MPH. And then the CAE is another professional designation that I have that's a certified association executive, because now I run an association. And so I, again, didn't know how to run an association, so I need to learn. So it's just, you know, one thing I will say about medicine and all of this is I hope you like learning, because it doesn't stop. You always need to be receptive to learning new things. You know, teachers now who thought like, oh, I know how to teach. No, you don't. You need to flip your classroom. You need to, to learn new ways of teaching students. Like, no, here's a pandemic. You need to totally, you know, forget what you learned and learn a new way to teach. So, you know, I think that's one thing I will say is you just always need to be receptive to new ways of learning, because learning is a constant when you commit yourself to be a doctor.
That's great. There was, kind of going back to the NP-PA questions, there's a question asking if an ND can be a supervising provider where that is required by state law. So if they have to like sign off on a PA's prescription or something, are you guys allowed to do that?
Yeah, that will depend on the state. So yes, and it will depend on the state scope.
Okay, great. Thank you for clarifying that. There's also a couple of people right now there's a little confusion on residency. So is it optional? Is that if you kind of want to specialize further? Okay.
Yes, residencies are optional, and that is something I did. I did a 1-year residency in family medicine, and you know, I was just, again, one of those people. I just kind of wanted to know it all. I didn't want to ever deliver babies as a thing, but I wanted to know how to do it in case I was the only person on an airplane. Like, you know, it's just one of those. So I just, you know, was like, okay, give me everything. And then other folks will do residencies to get honed in on a specific area. So pediatrics or cancer or, you know, what have you. But yes, residencies are optional, not required, except for Utah. Utah is the only state that requires residencies for practice.
Great. Thank you so much for clarifying that. So we had a question earlier. I know you mentioned it a little bit, but if you could just clarify this. If needed, can NDs prescribe medication, or is that even something that's thought about or possible? If you could expand on that a little bit.
Yes. So again, dependent on scope of practice in the state, but NDs do have prescriptive authority. Pharmacology is one of the courses that is the core, you know, core curriculum in that first 2 years of ologies. And, you know, I had when I wasn't in practice, you know, now, like I said, I'm the executive director. I have been for 8 years. But when I was in practice, I had a DEA number. I had, you know, federal registry and all of that, and, you know, prescriptive authority. So yes, they can and do prescribe. But again, if you go to that therapeutic order, we're looking at the determinants of health. So sometimes, you know, some of the areas where an ND may prescribe is if a patient comes in. So let's say you've got someone with, you know, hypertension, mild hypertension, and they want to get off of their hypertensive meds, or they want to see if they can do better. And so we will work with someone, you know, in diet and exercise and supplements and, you know, stress management and all of the things to hopefully get their hypertension managed. But you can't just take somebody off their meds. So, you know, that would be something where either we would work with a prescribing doctor, or we would keep them and taper them down as it's safe. Same thing with diabetes. You don't just take somebody off of their diabetic medications, but as they lose weight, as their insulin resistance improves, if you don't take them off of those meds, they're going to be in trouble. They're going to end up hypoglycemic. So again, those are the types of things where NDs will prescribe. They'll be prescribing hormonal therapies. They'll be prescribing even vitamins. Like if you want to do an IV vitamin drip on somebody, that's a prescription. So yes, long answer to a short question.
Thank you so much. That really helped. I know a lot of people were very curious about that, so thank you very much. There was also a very interesting question. It was if all the schools that you listed here offer that business class in the curriculum as part of the norm, or is it kind of based off each school, just to see how to start a practice?
Yes, there is definitely business curriculum. I always counsel students that, you know, start thinking about your graduation plan as early as you can. And this should go honestly for anybody. Like, this is a big investment in time and money and all of that. And so you shouldn't enter this in lightly. I always tell students, like, when you're walking across that stage with that diploma in your hand, you should have known 6-9 months before what you were going to do. So, that's the sort of thing that, really having that, yes, there are business plans. All the schools have career counselors and folks that will help, resume development and understanding your personal strengths so that you can get yourself placed in the right type of environment for you. But yeah, I will tell folks, it's medical school. And so you're going to get business training, but if you're wanting to start a business, you might need more, or you might need an expert who knows how to do that, because, if you've just graduated school and you've never had any, business training at all, a handful of business classes may not do the trick. So.
That's great. That really clarifies. A lot of people had questions about the business aspect. I think we'll do one more question before we wrap up, and we're going to kind of transition to COVID, the big elephant in the room. People were asking how COVID has really impacted how NDs practice, since it is a really holistic approach. You're not just out there like prescribing medication over the phone. Are you still seeing your patients, or how has that impacted your practice?
So again, I'm not physically practicing. All of the schools have academic clinics and academic medical centers. So initially, all medical students across the country, I was actually on a call right around when COVID was really hitting with the executive directors for medicine and dentistry and pharmacy and osteopathic and chiro and everybody. We were all on a call. And it was kind of like, and I'm a New Yorker originally, it was kind of like 9/11. When 9/11 happened and all of the airplanes were grounded. Like, every airplane that was up in the air was grounded immediately. It didn't matter if you were over Kansas, didn't matter where you were. It was like every medical student was grounded. Everybody was taken out of shift. Everything was just like, oh my God, we don't know what's going on. But like, we don't have enough PPE for the doctors. So if you have 6 students or 8 students on a shift and one doctor and everybody is seeing that patient, we didn't have enough PPE to have 9 changes of PPE every patient. Like, that was just not viable. So every student was grounded basically immediately. And we were all scrambling, trying to figure out, how do we get them trained? How do we get patient care taken care of? How do we do all of this and all these moving pieces? So initially, things were very drastically changed. And then as the smoke started to clear and as, PPE became more available, clinical training has revamped. I will say, though, that telemedicine has been like the rising star here. And, everybody has recognized, wow, there are a lot more things that we can do via telemedicine that we didn't think we could do via telemedicine. And there is technology that's emerging to help, do the assessments that maybe you don't need to be physically with a patient, but if they have blood pressure monitors that can send information to your computer, or, all of these, there's so many different things now available, apps and what have you, that there is a lot of, ability to practice differently than we thought. So practices now are incorporating a lot more telemedicine, telehealth, et cetera, but they are opening up as fit. And then there are NDs who are primary care doctors who have been doing COVID testing this whole time, who are starting to administer vaccines, who, like they're primary care. They're just doing what they have to do. So, all of that, it depends on the specialty. It's like, if you said to medicine, well, how has COVID impacted your practice? Well, the surgeons are going to say one thing, the ER doctors are going to say another. You're going to have different specialties saying different things based on how it's impacted them. So it's kind of like that in naturopathic medicine as well.
That's great. Thank you so much for all of this informative information. I think the last question that we have for you is, what last piece of advice would you leave us with as pre-med students, undergrads, post-bacs, especially in this time of COVID?
Well, there's a lot. Just one. So I would say, learn how to take care of yourself. Learn how to be mindful, how to take care of yourself, because times like this are stressful, and stress is going to happen throughout the course of your life. Like, that stress is ubiquitous. You're never going to get away from stress. So learn how you study, learn how to take care of yourself, like get that down before you go to medical school, because medical school is like, we've seen COVID as a massive stressor. Like, COVID is the type of thing that has just been such a disruptor that anything that's sort of teetering on breaking is going to break. And so medical school can be that type of a stressor too. Anything that's kind of off kilter, you know, when you throw massive amounts of stress at it, it can break. And so get yourself in really tip-top shape. The other thing that I will say is write down your why. Why are you choosing the path that you're choosing? And what is that passion? What is driving you to do it? Because there's going to be a time, there's going to be a patient, you're going to screw up a test, you're going to screw up on a patient, like something's going to happen. Somebody's going to tell you, why are you doing that? You know, there's always going to be something that's going to come into life and is going to make you question what you're doing. And you need to keep that why written someplace close and pull it out and remind yourself why you're on the path that you're on, because life is going to be hard and there are going to be unknowns popping up at you, or they're going to be naysayers. There's going to have something. And so write down that why. So know yourself, get yourself as strong and solid as you can, and know your purpose.
Dr. Yanez, thank you so much. We appreciate your time so much. And everyone has said they learned a lot. You just really broke it down really well for us. So we appreciate you being here so much. And the contact info is there for anyone that needs it. We'll go ahead and post the Instagram in the chat one more time. We hope you have a great rest of your day, and we look forward to hearing from you again.
Thank you.